Hi, I'm Dr. Jeanette with DeWitt Physical Therapy and Wellness. I am a physical therapist and athletic trainer and a fitness coach. And today we are going to talk about our DIY series that we're doing in September here at the office. And we're going to talk specifically today about how to use a hot pack. Now, one of the reasons that you might use a hot pack, actually several reasons that you might use a hot pack, is for the physiological benefits, or what a hot pack does to your body when you have heat applied. For example, you will increase your circulation, you'll increase your metabolism, it will increase inflammation, so it's not a good idea to use heat on a new injury, because you don't want to increase inflammation on an acute injury or an injury within the first 0 to 4 days. Heat can also decrease pain. It can reduce muscle spasm. It can reduce tissue stiffness, and it can decrease circulation or blood flow. So, it should be increases circulation or blood flow. Now, why would you want to use heat besides these physiological benefits, how your body's going to respond? Well, let's look again at the phases of healing following an injury. Now, as I mentioned before, in the first 0 to 4 days of an acute injury, I'll use an ankle sprain or a wrist sprain. You don't want to apply heat in that area because it's a new injury. You have inflammation, you have swelling in that sprain area, and increasing heat to it is not a good idea. That is when you want to apply ice. However, after 4 days, even maybe after 72 hours, you might be, not for a sprain, because a sprain is typically going to have swelling still, but if you've strained a muscle, for example, back pain, after 72 hours or after 4 days, you might be able to apply heat to reduce pain and reduce muscle spasming of that area. And you can use cold to reduce muscle spasms, but you can also use heat to warm the area, increase circulation, and decrease muscle spasms as well. I like to say, okay, when should I use ice and when should I use heat? Always use ice in the first 0 to 4 days following an injury. After that, if you have sharp pain, use cold. If you have intense muscle spasms, use cold. But if you have muscle achy soreness and tightness, I would say go ahead and use heat. Now, another great way to use heat is when you're in that late subacute phase. So acute phase is 0 to 4 days. A subacute phase is 5 to 14 days after the injury. And a late subacute phase is going to be in that last 10 to 14 days following an injury. This is a great time to, if you're experiencing stiffness or if you've lost some range of motion or you've lost some flexibility, it's a good idea to go ahead and apply heat, try and do some stretching, and then apply cold afterwards to reduce inflammation or pain or spasming following the stretching. So you kind of got a couple of modalities that you can be using, or 3 modalities actually, modalities in the sense of tools in your toolbox. So heat application, stretching, and then ice application. Again, that's that last 10 to 14 days of the subacute phase, which is 10 to 14 days after an initial injury. Now, after 14 days, you can absolutely continue to apply cold, but sometimes heat is actually more effective if there is no presence of inflammation, no presence of swelling, or if you had an open area, there's no signs of infection. You don't want to put heat on that area. If you have a chronic or an overuse injury, heat application often works really well and can be effective in relieving general muscle soreness, decreasing tissue stiffness, and improving circulation to that area. Now, when should you absolutely not use heat? You want to avoid heat application, again, in that first 48 to 72 hours or the first 4 days of an injury. You want to avoid heat in an area that has compromised circulation or poor blood flow. So if you have a condition where you don't have good blood flow, then you do not want to use heat in that area. You don't want to use heat application. If you have an area of compromised sensation, meaning you have a numb area or an area that you don't feel very well or it's really tingling, you don't want to apply heat to that area because you might not feel it if you've burned yourself. You also never want to apply heat to an area that has an open wound area or is at risk for an infection or has an infection in it. You do not want to spread that infection, and you don't want to increase circulation to that infected area. You also don't want to apply or lay on heat because of the high risk of burns associated with a hot pack. So these are reasons to avoid heat, or in the case of applying heat and lying on it, you can change your positioning so you can use heat, but you don't lay directly on the heat source. Now, how do you use a hot pack? Well, I've got a few things set up here. Let me adjust my camera just a little bit. Okay, so I have 2 examples of the Bed Buddy. Now, I preheated these, but you put these in the microwave, and every microwave is a little bit different. So what I recommend is, until you know exactly how well your microwave heats the beads in these, the synthetic beads, sometimes these packs are filled with rice as well. But until you know how your microwave is going to heat it, you want to start with 1 minute, and then after a minute and it buzzes, then see how hot it is, and make sure that you kind of move the beads around so that areas of high concentrated heat get moved and kind of mixed in with areas that might not have heated as well. Test it on the area that you're going to apply the heat, and then if it's not warm enough, go ahead and put it in for another minute, and just repeat that until the hot pack is hot enough for you. Generally speaking, this is anywhere between 2 to 4 minutes, but always test it after each minute until you know how hot your hot pack gets in your microwave. This is a Bed Buddy. It's the original. This is great for the neck area because it can kind of loop around. So this has not been preheated. The blue pack has been preheated. And this works really great. You can actually take a clip and clip it together, and it fits really nicely around the neck if you're having neck soreness or neck stiffness. Now, depending on how hot you make your hot pack, if you keep it in less time, you may or may not need toweling, but you definitely want to have a shirt or a towel between the heat source and your skin so that you don't get burned. And I'll talk about how many layers of toweling that you might need here in a second. This is the other, this one has been preheated, so it's a little bit warmer. This one also is a great one to put on your neck because it's not going to fall off. There's a nice Velcro here that it can stick on. So this is great if you have neck issues going across the shoulder and into this front region. Now, one thing I didn't mention is you never put hot or a hot pack on the carotid arteries here. You don't want to block your blood flow to your brain. and you don't want to have that amount of concentrated heat directly on your neck. So you have to apologize. This is a live video and my phone is ringing, so I apologize for that. But we will go on. So with this hot pack, what's nice about this too is you can actually make it into a circle, and then that can actually, if you have some knee arthritis, you can actually apply that onto the knee, and you can sit with that, or you can lay down with that around your knee, and that helps with knee soreness or knee arthritis. Same thing for the hip. You could be laying down, and then you can be seated with that right onto the hip region. Or if you want to sit or lay down and have this on your back, you would lay on your stomach if you can get into that position. Or if you are going to sit, now I know I said you want to avoid laying on a hot pack. That's if you're going to be going to sleep. If you're laying down onto the hot pack or sitting with a hot pack against a chair back, you can do that, but you have to apply enough toweling. And you should have anywhere between 4 to 8 layers of toweling between your skin and the hot pack if you're going to lay on it. So one of the things that you can do on a pack this size is you need to put enough toweling on for the hot pack. If you have hand towels like this, 1 layer of toweling equals 2 layers. So when we talk about 6 to 8 layers, 1 layer is 2 layers. So if I fold the towel in half, I now have 2 folds, but it's actually 4 layers of toweling on the hot pack. If you use a pillowcase, 1 pillowcase on both sides, so it'd be both sides of that, 1 pillowcase is actually only 1 layer. So it gets confusing. I recommend using towels. They're thicker. A pillowcase is not a good option. It'll get damp, and that wetness will go directly to your shirt and to your skin, and you can get a burn. So you want to make sure that you have at least 4 to 8 layers, and you would just double up on these. And this would be 2, 4, 6, 8. So if I wanted to lay down and lay on the hot pack, I now have enough layers between the hot pack or the heat source and my skin so that I don't get burned, but I can still feel the warmth. If I were going to use this on my neck, and I've made it super hot in the microwave, I can keep all of those layers on as well. I often will have people put a layer on top here because if they're holding it, now their hands are at risk for being burned. But hopefully you have a pack that can lay nicely or be Velcroed like this so you don't have to put your hands on the top of it. I hope that this is helpful because I don't want anybody to get burned. I've seen people who use heat and they don't apply it correctly at home, and they come into my office with a skin burn, and I've seen some pretty nasty burns from some hot packs. So be very, very careful with this at home. Now the next question would be is how long do I keep the heat on? Well, I would generally say 20 minutes. And simply because with the microwavable hot pack, what's going to happen is the heat source is going to dissipate, and you're no longer going to be feeling the benefits of the heat. In fact, it'll start to cool off. So generally speaking, about 20 minutes is the duration of heat. Some of the commercial hot packs that we use in a physical therapy clinic that are actually in hot water in a hydrocollator system, sometimes those hot packs can last up to about 30 minutes. But even then, they start to cool off. So duration of time for a hot pack application would be about 20 minutes. If you don't heat it as high in the microwave, it could be less than that. As you feel it starting to cool off, you can remove some of those towel layers so that you're still getting the same amount of heat. Again, I just caution you from burning yourself. Always check your skin. It should be a normal pink, a pinkish, it shouldn't be red. If it's bright red, the heat was too hot, you might end up seeing some blistering on your skin. Should never be a bright red. It should be just a light pink or a moderate pink area on your skin, so that you're not having it too hot where you can burn yourself. I know I spent a lot of time on preventing burns, but I have just seen, like I said, a lot of, well, not a lot, but I've seen enough people who have burned themselves that I don't want that to happen to you. So I caution you with that. But heat is a great way to decrease muscle soreness, to decrease stiffness for osteoarthritis in the joints. And it's just a great way to also help with muscle tension in the neck area if you've been at a computer for a long period of time and you just feel tight and sore from sitting like that, which that is another video conversation to make sure your posture is correct at your workstation. But I hope the heat, putting together a hot pack, is helpful for you, and I wish you the best with resting and relaxing and enjoying that heat. Thanks a lot and have a great day.